Hello, sir. Sir, am I audible?
Yes, audible.
Yes.
Hello.
Yes, sir. Yes, sir. You're audible, sir. Sir, in another 2 minutes, we'll start the session.
Okay. Yes.
Hello, good evening, everyone. I, Manish Kumar, welcome you all to the 16th session of Clinical Diaries, which is presented by Alva's Homeopathic Medical College and is hosted by Student Council. Now we'll proceed for the inauguration session. I would like to invite Hania for the inauguration session. Over to you, Hania.
Good evening, everyone, to the 16th session of Webinar Clinical Diaries of Alva's Homeopathic Medical College, hosted by Student Council. The speaker for today is Dr. Mohammed Ansar, who is a practitioner at Homeo Medical Trust, Thrissur. He had done his graduation at Dr. Padya Homeopathic Medical College, Ernakulam. We can say him an cardiology specialist. He had published many articles on homeopathic cardiology in Indian Express, Madhyamam, Manorama, etc. He has brought many talks regarding homeopathy and its scope. He has awarded Kerala Homeo Satarvedi Award. As a faculty, done many classes regarding homeopathic cardiology in the unit level, district level, IHMA, IHK, and many other organizations. He has treated about 2,000 more cardiac patients of different types of cardiac and lifestyle diseases. It's our pleasure to welcome you, sir. I also welcome our principal, Dr. Praveen Raj, Vice Principal, Dr. Roshan Pindo, and AO, Dr. Pragya Alva. Now, I hand over to Dr. Ansar for the session on the protocol of homeopathic cardiology. Over to you, sir.
Thank you. Can I start?
Yes, sir. You can start, sir.
Okay, thank you. Respected dignitaries, doctors, and dear students, I am dedicating this paper to our principal, S.N. Padiyar sir, who enlightened us with practical knowledge and brightened our future. Let me dedicate all my achievements of cardiac cases to my father, who have shown the generosity to submit himself as my first cardiac patient. Homeopathic cardiology is one of the difficult branch of medicine because we had no previous experience with this branch. We have many medicines in our books having symptomatic similarity with pathology of cardiology. But practical experience and evidence-based curative reports were very less. This protocol is absolutely with my own experiences and conclusions and criteria from treatment experiences and favorable miraculous result of about 2,000 cases of various types of cardiac ailments. This helps me to develop a super specialty branch of treatment with homeopathy, that is homeopathic cardiology. This was the first impression about homeopathic cardiology among people, even from our fellow homeopaths. It is quite natural that there may be thrown from various corners when a homeopath dared to take cardiac disorders. How can you prevent consequences if a failure occurs? Shall we prevent further attacks? Are you able to manage acute ailment? These are the frequently asked questions. Yes, this is an important doubt among the people. What is the importance of homeopathic cardiology? Usually, people have the awareness about advanced methods of cardiac care. In this situation, how can we convince the people about homeopathic cardiology? Other methods are always leads to huge financial burdens and severe complications and side effects, while uses long time. Homeopathic treatments give good results without any complications or side effects. Another question is the scope of homeopathy in the treatment of cardiac diseases. Yes, scope of homeopathy. Also a common doubt, which diseases are more effective to treat with homeopathy? One of the main questions among the common as well as from our fraternity. Cardiac conditions effective with homeopathy are coronary artery diseases, valvular diseases, aneurysms, arrhythmias, cardiomyopathy, characterized by thickening of cardiac wall, pericarditis, and heart failure. We can undoubtedly say that these cardiac conditions could manage with homeopathic medicines. Coronary artery diseases. It includes infarction, arrhythmias, and heart failure. Myocardial infarction, commonly known as a heart attack, occurs when blood flow stops to a part of the heart, cause damage to the heart muscle. A dreadful disease which will end in death unless treated or properly managed. In cardiac diseases, myocardial infarction is the commonest popular disease, commonly known as heart block. So we have special concern to manage it, and a detailing is necessary. Common causes and risk factors are smoking, stress, hypertension, diabetes mellitus, peripheral artery diseases, obesity, hyperinsulinemia, uric acid, and dyslipidemia. What is myocardial infarction? It is a condition occurs after the blockage in a coronary artery, which supplies blood to the cardiac muscles. This results in injury to the cardiac muscles due to lack of oxygen and nutrients. This is called myocardial infarction or heart attack. Common people say it is a heart block. What are the causes of myocardial infarction? As we know, the number one cause of myocardial infarction is dyslipidemia. It's a common belief, but I will say it is a false belief because prior to the dyslipidemia, some other metabolic disorders takes place, and that condition is more responsible to the myocardial infarction. Arrhythmias. Heart rhythm problems occurs when the electrical impulses that coordinate the heartbeats don't work properly, causing heart to beat too fast or too slow or irregularly. Feels like a fluttering or racing heart and may be harmless or bothersome, sometimes even life-threatening. Ectopic heartbeats are irregular heartbeats which cause variations in the normally regular pulse. The condition refers to both extra heartbeats and skip heartbeats. Types of arrhythmias. Tachycardia above 100 beats. Bradycardia below 60. Atrial fibrillation is due to a rapid heart rate. Atrial fibrillation is associated with serious complications such as stroke. Atrial flutter. Atrial flutter is similar to atrial fibrillation. The heartbeats are more organized and more rhythmic electrical impulses in atrial fibrillation. Right bundle branch block, left bundle branch block. These are the arrhythmias. Next, angina. One of the simplest form of heart disease. It is a chest pain or discomfort caused when your heart muscle doesn't get enough oxygen-rich blood. It may feel like pressure or squeezing in chest. The discomfort also can occur in shoulders, arms, neck, jaw, or back. Angina pain may even feel like indigestion. Homeopathy can use medicines like aconitum, arnica, chamomilla, latrodactus, amyl nitrosum, etc. during the acute attack. Cardiac valves. We know aortic valve, mitral valve, tricuspid valve, and pulmonary valves are the main valves in the heart. Valvular diseases are common. First come stenosis, then regurgitation. Mitral stenosis. The flaps of mitral valve become thick or stiff and they may fuse together. This results in a narrowed valve opening and reduced blood flow from left atrium to left ventricle. Mitral stenosis means that the valves cannot open enough. As a result, less blood flow to the body. The upper heart chamber swells, pressure builds up. Blood and fluid may then collect in the lungs tissue. That is called pulmonary edema, making it hard to breathe. The valve problems develop 5 to 10 years or more after having rheumatic fever. Calcium deposits forming around the mitral valve, radiation treatment to the chest, some medicines are the causes.
Hello, sir. Sir, I think the mic is muted, sir. Hello, sir.
This sometimes leads to MR, mitral regurgitation due to backflow. Mitral valve prolapse occurs when the valve between heart's left upper chamber and the left lower chamber doesn't close properly. In mitral valve prolapse, the leaflets of the mitral valve bulge upward or backward into the left atrium as the heart contracts. Mitral valve prolapse sometimes leads to blood leaking backward into the left atrium. Is a condition called mitral valve regurgitation. When the mitral valve doesn't close all the way, blood flows backward into the upper heart chamber from the lower chamber as it contracts. This cuts down on the amount of blood that flows to the chest of the rest of the body. As a result, the heart may try to pump harder. This may lead to congestive heart failure. The flaps of mitral valve doesn't close tightly, causing blood leak to backward into the left atrium. If not treated, it can result in heart muscle damage. This is commonly caused by mitral valve prolapse. In mitral valve prolapse, the leaflets bulge back into the left atrium as heart contracts. Next, aortic stenosis. As the aortic valve narrows, the left ventricle has to work harder to pump the blood. To do this extra work, the muscles in the ventricle walls become thicker. This can lead to chest pain. As the pressure continues to rise, blood may back up into the lungs. Severe aortic stenosis can limit the amount of blood that reaches the brain and rest of the body. It may be present from birth, but most often it develops later in life. Children with this may have other conditions present from birth. The flaps of aortic valves may become thickened and stiff, or they may fuse together. This causes narrowing of the aortic valve. The narrowed valve isn't able to open fully. It reduces or blocks blood flow from heart into aorta and rest of the body. Aortic regurgitation. Aortic valves regurgitation is a condition that occurs when aortic valve doesn't close tightly. Aortic valve regurgitation allows some of the blood that was just pumped out of heart's main pumping chamber to leak back into it. The leakage may prevent the heart from efficiently pumping blood to the rest of the body. As a result, may feel fatigued and shortness of breath. In aortic stenosis, mainly occurs due to the buildup of calcium deposits called calcific aortic stenosis in old people. In rare cases, calcium buildup develops quickly after a chest pain, chest radiation. Another cause is rheumatic fever. This condition can develop after strep throat or scarlet fever. Next, an important one is pulmonary artery hypertension. Having pulmonary arterial hypertension means that have high blood pressure in the arteries that go having pulmonary artery hypertension means that have high blood pressure in the arteries that go from the heart to the lungs. It's different from having regular high blood pressure. Next is cardiomyopathy. Cardiomyopathy is a condition where the heart muscle is abnormal. The main types of cardiomyopathy include dilated, hypertrophic, and restrictive cardiomyopathy. Cardiomyopathy is a disease of heart muscle that makes it harder for heart to pump blood to the rest of the body. Cardiomyopathy can lead to heart failure. Next, rheumatic heart disease. Rheumatic heart disease is a group of long-term and short-term acute or chronic heart disorders occurring due to rheumatic fever. Rheumatic heart disease is a preventable, treatable form of cardiovascular diseases. If left untreated, it can lead to valve damage, stroke, heart failure, and finally death. ASD and VSD, atrial septal defect and ventricular septal defect. This defect allows oxygen-rich blood to leak into the oxygen-poor blood chambers to the heart. ASD is a defect in the septum between the heart's two upper chambers. The septum is a wall that separates the heart left and right side. VSD, there is a hole in the wall that separates the two ventricles of the heart. Heart blocks. Heart block is a disease or inherited condition that causes a fault within the heart's natural pacemaker due to some kind of obstruction or block in the electrical conduct conduction system. This is an abnormal heart rhythm where the heart beats too slowly, which results in the electrical signals being partially or totally blocked between the upper chambers and lower chambers. Next, heart failure. Heart can't pump enough blood to meet your body's needs. Untreated, heart failure can be life-threatening. Protocols of myocardial infarction. Commonly known as heart attack, occurs when a portion of the heart is deprived of oxygen due to blockage of coronary artery. We know heart consists of coronary arteries, main four coronary arteries, right, left, left anterior descending, and left circumflex artery. LCS, left circumflex coronary artery. Okay, what is the difference? Myocardial infarction has two phases, acute and chronic. Due to some limitations, we are not too much trained to stabilize an acute condition and we have no casualties to manage it. After an acute stage, always patient needs to lifelong medicines for their better life. Now the so-called medicines are very dangerous and have life-threatening side effects. Most of the cardiologists insist the patients to use medicine of acute myocardial infarction for a long time, though it has life-threatening side effects. It is a trend in Kerala now to transplant organs, especially kidney. If somebody make a probe on why the incidence of renal transplantation increases day by day, the probe will end in an answer. It is due to mismanagement of various diseases. So far in my clinic, I have attended more than 2,000 cardiac cases previously managed by modern medicine. Most of the said 2,000 are with chronic kidney failure, fatty liver, and sexual disorders, and has been under treatment for such disease with modern medicine too. I'm sure that these patients slide back to cardiac disease due to the side effects of medicine they had. According to the protocol of treatment they had, they used medicines to reduce cholesterol, BP, aspirin as a blood thinning agent, and other medicines. According to the condition of the patient, they reduce cholesterol in subnormal. Next, risk factors. Risk factors including smoking, hypertension, obesity, dyslipidemia, diabetes mellitus, peripheral artery diseases, and family history. Cholesterol and smoking. What is the ultimate result if they had done such a reduction in cholesterol? Absolute energy loss and weakness, which also leads to a secondary MI or stroke. Don't try to eradicate cholesterol. We need it for our existence. So treatment must only be to manage when it rises above the normal. Don't think about the normal values advised by the medicine companies or labs. Consider only the international normal values. Few years back, All India Medical Institute, Delhi, after detailed study, announced a report that the normal cholesterol level must be maintained as 250 according to the Indian conditions. But the study was hijacked. The statement that cholesterol is the prime cause of heart attack is purely hypothetical one. I convinced it by evaluating 2,000 and odd patients in my clinic. I am damn sure it. Smoking. It accelerates the formation of atherosclerosis and affects circulation. Alcohol affects the metabolic balance and thereby affects heart section. Next, hypertension and diabetes. An important factor is hypertension. Uncontrolled hypertension is adversely affect on the cardiac muscle, result left ventricular hypertrophy. This retards the heart's action. Complications of hypertension includes heart attack or stroke. High blood pressure can cause hardening and thickening of the arteries, which can lead to a heart attack, stroke, or other complications. Aneurysm. Increased blood pressure can cause blood vessels to weaken and bulge, forming an aneurysm. Rupture, it may be life-threatening. Heart failure. To pump blood against the higher pressure in vessels, the heart has to work harder. This causes left ventricular hypertrophy. This prevents enough blood to meet your body's need, which may lead to heart failure. Weakened and narrowed blood vessels of kidneys prevent normal functioning. Thickened, narrowed, or torn blood vessels in the eyes result in vision loss. Metabolic syndrome, dyslipidemia, diabetes mellitus, hypertension, and high insulin level in blood. These are the ultimate result of hypertension. Diabetes mellitus. Diabetes mellitus, it is very dangerous one than any other cause. Diabetes reduces the elasticity of the blood vessels, especially the capillaries, which reduces the increased demand of oxygenated blood to the cardiac muscle during work. Obesity. Obesity is another predisposing cause. In general, overweight and obesity indicate a weight greater than what is healthy. Obesity also increases the risk of developing a number of chronic diseases. Insulin resistance, type 2 diabetes, hypertension, high cholesterol, stroke, heart attack, congestive heart failure, cancer, gallstone, gout and gouty arthritis, osteoarthritis, sleep and sleep apnea. This is atherosclerosis. Obesity is a well-known risk factor. For atherosclerosis, is hardening and narrowing of the arteries. It prevents easy blood flow and causes heart attacks, strokes, and peripheral vascular diseases. Family history. It is an important predisposing factor and tendency of sudden heart attack and death among certain families should be considered during treatment as well as in follow-up. This can be controlled with homeopathy as a prophylaxis. Hyperinsulinemia. This is an important unnoticed condition prior to the metabolic disorder. If insulin resistance starts, that is a sign of metabolic disorder. Increased triglycerides, high plasminogen activator inhibitor activity causing increased risk of clotting, low HDL cholesterol, hardening of arteries, that is called atherosclerosis. Atherosclerosis can be detected by D-dimer test, normal value below 500. High triglycerides, a cause of increased risk of heart attack and stroke. High plasminogen activator inhibitor activity, a factor responsible for increased risk of clotting. Cystic ovarian disease, obesity, high uric acid, polycystic ovarian disease, high uric acid, obesity, and type 2 diabetes are the ultimate result of insulin resistance. Hyperinsulinemia causes high uric acid, Type 2 diabetes, obesity, hyperinsulin can also stimulate the kidney to produce angiotensin enzyme, a substance which increases the blood pressure. Insulin resistance. Why insulin resistance is medically important? Insulin resistance causes abnormal ovarian and adrenal androgen secretion, which results in polycystic ovarian syndrome. This promotes heart attacks, stroke, type 2 diabetes, obesity, hypertension, endocrine disorders in women, and clotting problems. Treating insulin resistance syndrome can significantly reduces the health risk, especially prevention of coronary artery diseases. Insulin resistance promotes heart attacks, stroke, type 2 diabetes, obesity, hypertension, endocrine disorders in women, blood clotting. How can you treat insulin resistance syndrome? By lifestyle modification, lower triglycerides, elevate HDL, control diabetes and BP, lower plasminogen activator inhibition activity, lower uric acid, reduce body weight. Lifestyle factors. Number one, eating habits and exercise. Control your portion size. You must control the food, how much you take. Eat more vegetables and fruits. Limit unhealthy fats. Avoid trans fat. Fats to choose are olive oil, canola oil, vegetable and nuts oil, margarine with the trans fat free, cholesterol lowering margarine, nuts, seeds, avocados. Choose low fat protein sources. Proteins to choose. That is low fat dairy products such as skim or low fat milk or yogurt, cheese, eggs, fish, especially fatty cold water fish such as salmon, skinless poultry, legumes, soya beans, and soya products such as soya burgers and tofu, lean ground meats, reduce sodium intake. Next, exercise. Brisk walking, running, swimming, cycling, playing tennis and jumping rope, heart pumping, aerobics exercise is the kind that doctors have in mind when they recommend at least 150 minutes per week of moderate activity. Next, type A personality. Type A category people, aggressive, impatient, competitive people are more prone to coronary artery diseases. Type A individuals as outgoing, ambitious, rigidly organized, highly status conscious, impatient, anxious, proactive, and concerned with time management. People with type A personality are often high achieving workaholics. Next, mental tension. Sudden shocks and failures in life is a very dangerous one, which may be very harmful to the life by sudden stoppage of heart called cardiac arrest. I remember a case. A male patient in an Orthodox Brahmin family, about 65 years old, live with wife, son, and a daughter. About 1 year, he was under my treatment. During case taking, I had inquired about the family, and then he disclosed that his daughter is now at the age of marriage. She completed B.Tech, but she is not willing to marriage after the watch, after close watching. They understand that the girl was in love with a boy belongs to a lower caste. They tried to convince her about the social depreciation of such a relationship, and she agreed to give up the affair. In next visit, he was very happy and said that his daughter agreed to marry a man from their caste itself as per their wish. In that visit, blood values and BP, sugar, etc. were absolutely normal. He went back in a happy mood. After a week, that patient called me and he said that his daughter went away with her old boyfriend. And he feels some uneasiness and pain on chest. He was much tense. I advised him to go to a hospital and take care. After 2 days, he called me at 2 p.m. and said that today at 3 p.m. was the proposed time and date of her marriage. I can't bear this. I am not well. He was very much disturbed. When he told that, I was wordless to console him. After 2 days, his neighbor informed me that he is normal. One important point we homeopaths must consider in this case that we never forget to. When advised them to consult a cardiologist, they did it at once. But cardiologist cannot save his life. He lost his life. It is pathetic, and I realized that how much the mental injury affects the heart, but not prescribed at all. My humble request to my beloved homeopaths is to prescribe at least one dose of medicine on the basis of mental agony of your patient in that instance. Just before referring him to a cardiologist, maybe Ignatia, Staphysagra, Phosphorus, or Tuja, whatever it may be, here Aconite or Arnica may help to prevent sudden shocks. There is a rubric, chest pain, heart emotions aggravates, that is Phosphorus and Tuja. Anyway, next, symptoms of heart attack. Common symptoms occurs during exercise or activity. Heart experiences increased demand of nutrients and oxygens that cannot be met because the coronary arteries are blocked. Chest pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath with or without chest discomfort. Other signs such as breaking out in a cold sweat, nausea, or lightheadedness. As with men, women most common heart attack symptom is chest pain or discomfort. Diagnosis: ECG and echocardiogram. An electrocardiogram records the electrical signal from your heart to check for different heart conditions. Changes in the ST wave is the main point for diagnosis. ST elevation will be presented in a myocardial infarction. Basic abbreviations of echo. Normally, we can see these abbreviations in an echo report. AR, MR, TR, MS, LVH, LVF, LBB, RBB. AR means aortic regurgitation, MR, mitral regurgitation, TR, tricuspid regurgitation, MS, mitral stenosis, LVH, left ventricular hypertrophy. LVF, left ventricular failure. Left bundle branch block. RBB, right bundle branch block. Another one is RWM, regional wall motion abnormality. The affected area of heart will be akinetic or hypokinetic. Hypokinesia means movement is reduced. Akinetic means completely lost the movement. Global hypokinesia, another term, which here heart fully affected with the infarction. PAH, pulmonary artery hypertension. These are the basic abbreviations seen in the echo report. Next, the basic blood tests. Sugar, cholesterol, lipoprotein A, lipoprotein B. These are rarely examined during this era because nobody is ready to go detailed case study. They have minimum protocols and they continue the orthodox protocols nowadays. Next, RFT, renal function test, TFT, thyroid function test, KFT, kidney function test, LFT, liver function test. Moreover, electrolytes, routine blood, pro-BNP to detect heart failure, D-dimer, atherosclerosis, also serum insulin and C-peptide. These are the basic tests need to diagnose or need to know the cause of heart attack, which will help to the cause of heart attack. Next, blood test during casualty. These are the tests to diagnose a sudden heart attack is occurred or not. Troponin. Troponin is the latest and simple test. Sudden, we can understand there is any heart attack occurs. Another one is CPK-MD. Next, LDH, high sensitivity CRP. That is for, it is a cardiac marker also. In a healthy person, we should examine if there is a possibility to have any heart attack in future. Also, PR, pro, BNB, and D-dimer. This is the angiogram. Here we can see the blocked arteries. That is stenosis. Not any foreign body lodged in the artery, but it is stenosis. Next, we go to the homeopathic management. Each person experiences heart disease differently, and no one treatment method was for everyone. No one treatment method was for everyone. A multifaceted approach of dietary changes, exercise, and medications may be combined. Depends on patient's individual situations and need. Do homeopathy works in coronary arteries? It is a common question asked by general public. Physicians of other school of medicine, even by homeopathy. Let me say, from my experience, homeopathy is very much capable of treating and curing heart disease like myocardial infarction, valvular diseases, rheumatic heart disease, cardiomyopathy, conduction defects like AV node, SA node blocks, and ectopic beats, and we can offer a cure rate than the so-called modern medicine offered. In our Materia Medica, more than hundreds of medicine have direct indication to the heart diseases. Common protocol, that is beta blockers, nitrates, calcium channel antagonists to reduce coronary spasm, antiplatelet drugs. We have same protocol medicines in our Materia Medica. The most indicated homeopathic medicine. Homeopathic medicine are very effective and indicated if the totality corresponds. The specific indicated medicines give good result. We are giving equal importance to pathological symptoms and patient symptoms. Every patient has their own individuality in symptoms and suffering. That has to consider a homeopathic prescription, but that doesn't mean pathological symptoms are not important. In acute condition, we can give arnica, aconitum, amyl nitrosum, chamomilla, cactus. In my experience, I am using 30 potencies, repeated doses. According to the situation, we repeat even in half an hour, 1 hour, or 2 hours. Myocardial infarction. These are few medicines. Amyl nitrosum, cactus, latrodactus, Laura cerasus, digitalis, convallaria. These are more effective to MI patients. For angina, we can use aconitum, ammonium tar, epis, argentum nitricum, arnica, oromet, ars, ginkgo biloba, spigelia, lilium tick, cactus, lactasis, latrodactus mactans, naja, acid oxalicum, phosphorus, rustox, spongia, etc. Homeopathic protocol, beta blockers. We can use these medicines as a beta blocker to control hypertension. These are atropine, digitalis, glonine, veritamio, veratum derived, Rolfia, lycopus. Here I am using Rolfia lycopus in potencies as well as in tinctures. Atropine, digitalis, atropine, glonine, veritamio, veratum derived. These are 30 are using. Also, digitalis tincture also used to reduce hypertension and further conditions. Nitrates. These are the acute pain management medicines. Arnica, amivisnega. Amivisnega used the tinctures, using tinctures. Bellis perennis, Arjuna tincture as well as 30. Cactus, aconitum, chamomilla. At the beginning, we can use aconitum to reduce the pain. Aconitum pain always, pain tossing about agony, severe restlessness. These are the indication for anxiety, fear of death, fear, very expressive these conditions. So we can use aconitum in the initial stage and thereby reduce the severity of the condition. Calcium channel antagonist. That is Silesia calcareiflow crataegus. Crataegus is used to reduce the calcium deposits in the blocks and as well as in the valves. If there is calcium deposits in valves, Crataegus is more helpful than any other remedy. I'm using 30 and tinctures. Also 3x, also drop dose use. For LDL, we use the tinctures and 30. Here, Berberis vulgaris, Tuja, Cardus, Fucus, then Silesia, Lapis alba, Phytolacca berry. Here, Silesia and Lapis alba uses 30th, but others are using as tincture form. Also, Tuja and Berberis 30, 200, Tuja 200 or 1M also used. Cardus also tincture as well as 30 used. To increase HDL. This is an important factor because many patients are coming with low levels of HDL. Our responsibility to increase HDL because HDL reduces the risk of heart attack. Here, Avena sativa, Crataegus, ginseng, alfalfa, more helpful with prescribed food diet. The diet is an important factor to enhance the HDL level. Triglycerides. This is also an important one. Many patients are coming with triglycerides, especially if they have used more alcohol or any Ayurvedic preparations, they will complain of increased triglycerides. In that time, you should examine an ultrasound to evaluate the liver condition. Also, LFT should be noted. Here, something will be elevated in LFT. Here, Cardus is an important medicine to control triglycerides. Also, other liver remedies should be experienced. Also, we can prescribe other liver remedies. Here, some food restrictions also with some food additions. Here, if triglyceride increase without the increase of uric acid, even there is uric acid increase, not recommended. That is, egg with yellow is very helpful to reduce triglycerides as well as reduce the liver enzymes. Also, fatty liver, even if a drunkard. That is very important one. If there is any hike in uric acid, don't prescribe egg. That is, administration of protein will increase the purine mechanism and there will be hike in uric acid level. So you should aware with this. Also, another study we have recently heard that black coffee is very beneficial to reduce liver enzymes. If you take black coffee 2 glasses per day, even if you are preferred to avoid sugar, more effective. That's another factor recently I got. Okay, Cardus, Garcinia, cinnamon. These are very useful in triglycerides. You know what is Garcinia, what is cinnamon. Okay. Next, some specific tinctures. Avena, Adonis, Allium sativa, Sumbal, Berberis vulgaris, Borevia, Cardes, Crataegus, Ginseng, Lycopus, Phytoberry, Rolfia, Arnica, Arjuna, and Fucus. According to pulse, if there is pulse is fast, aconitum, epis, ars, arnica, arside, aurum, acid force. Also bell, berberis, bryonia, Collisonia, Crotalus, Cuprum, Digitalis, Ferrophos, Gelsemium, Glornine, Iodum, Natrimure, Phosphorus, Pyrogen, Spigelia, Sulfur. If the pulse is 80, phosphorus, if 85, lachesis, 86, calicar, 96, tarantula, 100, ignatia creos, 108, cyclamen, kaliaid, 120, baptisia, sina, cupramet, lachesis, lyco, mux cyanatum. Also, if 140, that is sina. I get best result with tarantula. When I got a pulse rate of a patient about 96, and I given it best. It was a best result. Slow. These are another important one. Many patients are coming with a slow pulse rate. That is due to some pacemaker complaint or conduction defect or any other. In this condition, we can use Berberis vulgaris, Cannabis indica, Digitalis, Gelsemium, Calmia, Opium, Sepia, Stramonium, Veratum, Veratum viride, etc. If pulse 40, Calmia, 60, Atropine and Crotalus horridus, 60 during rest and 120 after motion. This is another medicine. 65 Moscus. We can go through some medicines using, these are the important symptoms we consider. Tachycardia, aconitum. Tachycardia, pulse full, heart tense and bounding, occasionally intermits. Pain in left shoulder. Temporal and carotid arteries felt while sitting. Next one, Adonis, rheumatism after fatty degeneration. This is a medicine for diuretic, having diuretic effect. If there is pulmonary artery hypertension, Adonis is a good medicine. Also, rheumatic heart diseases is one of the good medicine for rheumatic heart disease. Rheumatism after fatty degeneration, regular pulse and increase the power of contraction, pulse slow, weak heart. Cardiac dropsy, EH promotes diuresis. Mitral regurgitation, aortic regurgitation, chronic aortitis, pericardial pain, palpitation, and dyspnea. Cardiac asthma, pulse rapid and irregular. In all cases, the pulse is an important factor. If they have under beta blockers, there will be no chance to take original pulse rate. Before that, we should advise them to stop the beta blockers and should notice the pulse rate. Next, aposino, pulse frequency diminished, dropsy, ascites, anasarca. Tricuspid regurgitation, rapid, feeble, irregular cardiac action, low arterial tension, pulsating jugulars, general cyanosis and dropsy. These are the indications. Another, arnica, angina, pain, severe on elbow of left arm, pulse feeble and irregular, cardiac dropsy and with dyspnea, fatty heart and hypertrophy. Many cases, the patients come with hypertrophy of heart because they are affected hypertension in a long time. Mohammed, sensation as if heart stopped beating for 2 or 3 seconds, immediately followed by tumultuous rebound. Arteriosclerosis, high BP, pulse rapid, feeble, irregular, hypertrophy of heart, valvular lesion of arteriosclerosis nature. Avena, rheumatism of heart, alcoholism, sleeplessness of alcoholics, bad effects of morphine. Next, Beritacarb. Beritacarb is a very good remedy to control hypertension, aneurysm and senility. Arterial fibrosis soften and degenerate the blood vessel, become distended, leads aneurysm, rupture and apoplexy. Palpitation, when lying on left side, when thinking of and distress in region of heart. Accelerates heart's action first, BP increase, pulse full and hard. Next, Baritamu, arteriosclerosis, hypertension and vascular degeneration, high systole with low diastole. Is an important point. Next, belladonna, violent palpitation, reverberating in head with labored breath, palpitation from least exertion, throbbing all over the body, dicrotism, rapid but weak pulse, heart too large. Next, cactus. This is an important medicine. Atheromatous arteries and weak heart with arteriosclerosis. Toxic goiter with cardiac symptoms. Pulseless angina. Pulseless angina, low BP, endocardial murmur. Constriction in chest like an iron bell. Tobacco heart, a typical heart remedy. Violent palpitations, worse in left side. Another important one is calcarea arts, slightest emotions causing palpitation, dyspnea with feeble heart, albuminuria, dropsy, HB and RBC low, constriction and pain on cardiac region, suffocation, palpitation, oppression, and throbbing pain in back extending to arms. This is also an important remedy. Next, calcarea carb. Palpitation at night after eating. These symptoms occasionally presented with some patients. Centuries, feels distended, feels whole chest as if fell down in abdomen. Sharp stitches, fluttering under left scapula. These symptoms are rarely presented with some people. Convallaria, another tobacco medicine. Ventricles over distended dilatation begins, absence of compensatory hypertrophy, dyspnea, dropsy, aneuretic tendency, anasarca, feels heartbeat throughout the chest, extreme orthopnea, sensation as if heart ceases beating, then starts suddenly. Tobacco heart, angina, pulse rapid and irregular. Next medicine goes to digitalis. Pulse abnormally slow, weak, irregular, and intermittent. Dropsy, weakness and dilated myocardium. Slow pulse in recumbent position but irregular and dicrotic on sitting. Rheumatic fever with auricular fibrillation. Heart block stimulates the heart's action. Irregular in mitral stenosis. Sensation as if heart stood still. Pulse weak and quickened by least movement. Cardiac failure. And an important medicine, gelsemia, slow pulse with extreme weakness of old age, feels as if heart action ceases unless moved. Next, glonine, laborious action, fluttering, palpitation with dyspnea, cannot go up hills. Any exertion brings on rush of blood to heart and fainting spells, throbbing whole body, even fingertips. Iberis amara, hypertrophy with thickening of heart walls, conscious heart section, turning on left, stitching pain as of a needle through ventricles, felt at each systole, stitching pain in cardiac region, palpitation with vertigo and choking due to slightest exertion, laughing or coughing, pulse full, irregular and intermittent, worse least motion and warm room, sensation of weight and pressure on chest, dropsy with enlarged heart, cardiac dyspnea, dilatation of the heart, wakes with palpitation and 2 a.m. Tachycardia is an important medicine for hypertrophy. Next, spigelia, severe palpitation, chest pain, aggravation from movement, halitosis. Halitosis is a condition which associated with hypertension. Pulse weak and irregular, neuralgia extending to both hands, angina, craving hot water relieves, rheumatic carditis, dyspnea, must lie on right side with head high, trembling pulse. Lilian tick, sensation as if heart grasped in a voice, feels full of bursting, palpitation, irregular pulse, very rapid, pain in cardiac region with feeling of a load on chest, cold feeling of a heart, pain, suffocation in crowded and warm room, angina with pain in right arm is an important point. Now I am presenting some cases. This is a case of coronary artery disease, double vessel disease, type 2 diabetes mellitus, trivial MR, mild LV dysfunction, admitted in the hospital with chest pain. Echo shows 42% ejection factor, RWMF plus hypokinesia of the mid androseptum, anterior wall, anterolateral wall, apical IVS, ventricular septum, apex and apical wall, anterior wall of left ventricle, trivial MR, mild LV dysfunction with preserved thickness, 44, tearing sensation in left side of chest, smoking and tobacco chewing, sugar, high BP, 140/80, pulse 96 per minute, weak heart. This come on 15/12/17. Here, medicine prescribed was Convallaria 30, Lilium tick. Next, uranium 200, Cactus 30, Aconitum 30, and Ginkgo biloba during this period. Then, after few months, about 7 months, 11/7/2018, we got this echo report from Lourdes Hospital. Normal LV systolic function, no definite RWMA, grade 1 diastolic dysfunction. That was the only defect they noticed. Also, LVEF increased as 63. Previously, it was 43, 42. These medicines I was given 2-3 medicines at a time and repeated continuously and repeated in every month according to the status quo. We changed the medicines slightly. After 6 months, we got this result. Another one, ASD with left to right shunt. 7 years old girl, mild pH, dilated right atrium size 6 mm, mild tricuspid regurgitation. Cardiac murmur present, both tonsils enlarged, adenoids, body weight was 25 kg. This is the echo report from Satyasai Institute. Left to right shunt, mild pH, asymptomatic, good LV-RV function. This is another result. They checked in 2 hospitals. I had given iodine 30, calendula 30, tuberculin 200, Adonis tincture, 10 drops TDS. After a few months, I got the result, mild RV dilatation, normal LV and LA, normal valves, no MR, no AR or PH, small echo dropout in fossa ovalis region with no flow approach, no VSD, no PDA or coarctation. Another condition, dilated cardiomyopathy. Patient was heaviness in chest, heaviness in eyes with drooping, unsteady. BP was 140/110, right hand. Left hand 130/80. Clubbing of fingers noted, pulse 72 per minute. Echo EF was 35. Ischemic heart disease, globally hypokinetic, trivalent TR and MR. The medicines prescribed was gelsemium, convallaria 30, Iberis, Crataegus tincture, atropine, Laura cirrhosis 1, aconitum 30 occasionally. Here, few months later, I got RWMA, regional wall motion abnormality of anterior wall and septum. Overall, mild to moderate LV dysfunction. Valves are normal. Previously, there had some complaints in valves, mitral regurgitation, etc. Next, another case, coronary artery diseases, past history of TB, diabetes mellitus, chest pain with a distension of abdomen, pain on right side of chest, pain on right side of chest, BP 130/80, smoking, talkative, fasting blood sugar 120, total cholesterol 210. Left ventricular diastolic dysfunction, concentric LVH, no regional wall motion abnormality. This is the condition. EF 65%, mitral annular calcification, thickened aortic valve, trival MR, reduced EF. Then after a few months, I got this result with these medicines. Convallaria 30, Lacasis 200, Iodam 1, Adonis tincture, Urolatricum 1, Beriberi 30. Echo taken from Mother Hospital on 17/8/80. EF was 66%, no RWMI, good LV-RV function, valves are normal, no MR. Here, concentric LVH, mitral annular calcification. According to the Alva, the calcification never revised or never cured with any medicine. That is their conclusion. Thickened aortic wall, trival Emma. Another, this is one of our fraternity, his father, CAD double vessel disease, proximal LAD, 70% stenosis. D1 shows discrete 80% stenosis. DM since 3 years. Diabetes mellitus since 3 years. Suffocation, substandard after walking. Weight 60 kilogram. BP 120, 80. Here, concentric LVH, LVDD. First, good LV systolic function. This is from Alva Medical College. Result, trival AR, Cactus 30, Acronator 30, Spigelia 200, Cretaceous tincture, Arjuna tincture, Convallaria 30, Calcareas 30, Iberis. These are the medicine used during this period. Here, one echo was taken on 8/1/17. After that, recently they had taken an echo that seen normal study. That is the latest report from that patient. Okay, we can go through the food what we eat. It is an important factor in the treatment. A balanced diet is essential for a speedy cure. Food rich in starch and fat are equally harmful. Best choice of food with rich protein, low carbohydrate and fat. Minimum amount of fat is daily need for a harmonious metabolic activity and absorption. Here, walnut, almond, sweet potato, egg with yellow, chicken, fish, cereals and pulses, fruits like apple, orange, pineapple, anar, grapes, banana, vegetables, lemon and amla are good for these types of patients. Why we suggest egg with yellow? Egg is a rich source of nutrients. It contains choline, various vitamins and minerals. These are very helpful to prevent coronary artery diseases. These vitamins and minerals. These fruits are very beneficial. Nuts are beneficial. Antioxidants and omega-3 fatty acids are rich in these things. Sweet potato, walnut, broccoli, tuna. Avoid this. Fried and oily foods. Use minimum quantity of salt and sugar. Also avoid alcohol. I think there will be changes of attitude towards the subject in future. This is a spark got from my father when I had treated, and I observed and improvised through thousands of my patients. Now I am sharing this with you. So never say we have no treatment for cardiac diseases. Realize our system and make expression like this. Okay, I am concluding this with much thanks, especially to Dr. Praveen sir, Vice Principal Dr. Roshan Pindo sir, AO madam, and other students and the Students' Council Chairman of Alva's Homeopathic Medical College for the privilege given to me to present this paper in this occasion. I also thankful to all doctors and students attended this webinar to hear my words. Thank you. Thank you so much.
Thank you, sir. Thank you so much, sir. Sir, if time permits, sir, can we go for 5 or 10 minutes question answer session, sir?
Sure. With my Linux, I can
If
understand.
participants having any doubt, they can put their questions in the Zoom chat box, and the participants who are watching us in YouTube, they can put their questions in YouTube chat box. Favor, kindly bring the questions from YouTube chat box.
Sir, Said Samir in YouTube has asked how to manage a patient on allopathic medicine for cardiac complaints. Is it possible to stop allopathic medicines?
Normally, we are doing a parallel treatment with allopathic as well as homeopathic treatment. Only we taper the medicine after 2-3 months. First time, I am giving homeopathic medicine along with that allopathic medicines. Normal case, the medicine, if there is any medicine to reduce cholesterol, that will stop. That will supplemented or that will be with our medicines. Cholesterol medicine will be added from our medicine, and the allopathic statin tablets should be stopped. Then other medicines are continued along with this medicine, and after getting much better results, taper the medicine one by one. Then few months later, we can stop the complete medicine from the allopathic side. Have you understand?
Yes, sir. I think it's clear, sir. So another question from Dr. Sujit. Sir, after prescribing alpha, if patient appetite will increase, so how to overcome this?
What? Pardon?
Sir, after prescribing alpha, if patient appetite will increase, so how to overcome this?
Alpha.
Yes, sir.
Diet. I can't understand what.
Sir, I think the question is not clear, sir, in the chat box. Sir, he's asking like if we are prescribing alpha, then if with that appetite is increasing of the patient, so how to manage that?
We are always prescribing alpha to increase the increase the intake of food. How can we manage? I can understand the question.
Yes, sir. Dr. Sujit, you can just write the questions once more. Like what kind of food should be given to increase HDL?
Increase HDL. Okay, good question. We can suggest one almond, also walnut, also fishes, also eggs with yellow. Then decrease the amount of starchy food, reduce the amount of starchy food. These are the best things we can do to enhance the HDL level.
Thank you, sir. Another question from YouTube, again by Said Samir, is can we give our medicines in cases having artificial pacemaker implants, especially in conditions where medicine indicated is like silesia?
I have some doubts regarding this. I am not supporting, perhaps it will reject from the patient. That is not entertained by me. If there is an artificial implant, I am not supposed to do such a thing. Okay.
Sir, one more question is there. How many drops of mother tincture you use, sir, and how frequently?
Usually, I am using 1 or 2 mother tinctures along with a prescription. Then one will be 10 drops TDS, one will be 15 drops BD, morning and evening. Sometimes I will give 15 drops morning, one medicine. Another one will be 15 drops during night. Only 10 or 15 drops preferred.
Sir, another question from YouTube
Okay,
is
Feba, any more question is there in YouTube?
Shubhaprabha Gote has asked, can we treat a patient having 90% blockage prevent angioplasty?
Sure. Even some patients, some results said there is 100% blockage. Even if 100%, there will be a anastomosis and angiogenesis had takes place unless the patient will not survive. So we have to do medicines to enhance the angiogenesis and bypass, natural bypass by giving our medicine. Our medicine usually doing natural bypasses and increases the angiogenesis. That is why we have to get more result. That is why we are getting akinetic area to kinetic. So even if 100% or 90%, don't worry, that can be cured with or managed with homeopathic medicine.
So another question is there, sir, how to handle heart diseases caused due to homeopathic separation?
Pardon? How to?
How to handle heart diseases caused due to homeopathic separation?
How to have?
Sir, you got the, sir, how to handle heart diseases which is caused due to homeopathic separations?
Homeopathic separations.
Yes.
What you mean
So,
by
sir, how to
homeopathic?
handle those cases? I
Homeopathic
think, sir,
separations.
yes, sir, if any heart diseases is there, then how to handle that if it is caused due to homeopathic separations?
I don't know
Sir,
what is.
I think the question is not
Handle.
complete, doctor.
I,
Yes, sir.
I can understand how to handle the medicine. Have the having homeopathic separation. That's the question. Yes.
Yes, sir.
Sorry. I can understand.
Doctor, yes, sir, Dr. Sumaya Fatima, you can unmute yourself or you can write the questions once more in the chat box. Sir, any emergency medicines during cardiac arrest, both in allopathy and homeopathy medicines?
Pardon?
So another question is there, sir, suggest some emergency medicines during cardiac arrest, both in allopathy and homeopathy medicine.
Allopathic medicine, I don't know what are the medicines doing casualty. Our medicines using casualty is amylite, rosmarinium, arnica, chamomilla. These are the medicines more good to prescribe in an emergency situation. I don't know about allopathic medicines.
Sir, I think questions will be keep coming, sir, and we are already running out of time, sir. Sir, if you'll provide your email ID, they can mail the questions in email ID. Is that okay, sir?
Okay, I will send you. Do you want now itself? Dr. Mohammed Ansar at
Yes, it will be better.
gmail.com.
Yes, sir. Sir, if you'll put in the chat box, that would be better, sir.
That box, email ID.
So participants who having any more questions, they can just email their questions to sir's email ID. Feba, any more questions there in YouTube chat box? Hello, Sai Kiran, can you check YouTube chat box? Hello, sir. Sir, I think now we can conclude the session, sir.
Okay.
So I, on behalf of Alva's Homeopathic Medical College and Student Council, extend a very hearty thanks to the Honorable Dr. Mohammed Ansar for the informative and inspiring session. We are really enlightened with your knowledge and experience. Thank you so much, sir, for your valuable time. Our heartfelt thanks to our attendees for active participation. With this, we move to the end of today's webinar. Thank you, everyone, and good night. See you next day. Thank you so much, sir. Thank you, sir.
Very well.